Hello. Hi, Wilson. How are you?
I'm good, thank you.
Great. Thanks
How
so
are you?
much for joining me and agreeing to take part in this peer-to-peer series.
Thank you. I'm excited to be able to share what I've learned along the way.
Great. Do you want to just introduce yourself to the audience?
Sure. My name is Wilson Nice. I'm a speech pathologist and I live in New Mexico. And I have a rural located private practice. And I'm the primary provider. And we have a physical location. So we do hybrid services or in-person only or telepractice only.
Got it. Okay. And let's see, when did you take the class?
Was January of 2020. You came to Albuquerque,
Okay.
and that was an amazing experience. And then that was the introductory voice and swallowing course. And then I followed up the next year in the fall in Santa Fe. You had a balancing the body course. And
Yeah, yeah. Right now that's only offered online, but I'm thinking of kind of bringing that back to life for a few select locations. But so the whole point of this is for you to kind of share your story, share your tips, share your frustrations, etc.
sure. I really am thankful I took the courses. And at some point, I'd really like to take the advanced course. I think that that would be great. I also am really interested in some of your online offerings. When I'm able to, I'd really like to do that. And I'm glad that you and I first spoke. We met each other on social media, and I said, please come to New Mexico. Please come to New Mexico. And so that ended up happening in 2020. And I really, really liked the class. Unfortunately, it was, in the midst of the pandemic when things were really heightened. And I was basically informed by the home health agency that I worked for at the time, to, not proceed with any kind of you know, uh, tongue work or mouth work or any kind of touch-based interventions. So I kind of had a pause for about a year, and then you came back to New Mexico, and I was able to, have a chance to put into motion what I'd learned in the first class more, and then revisit all of those topics. And then after the balancing the body course, that's when I really started using the techniques from both courses.
Right. Did you struggle with that, with figuring out how to make yourself as an SLP kind of shift to see that, yeah, this is within my scope of practice?
I really did. Um, I think the reason why I did is because I categorized what the class was going to be like before I got there. I put it in a box. I said, "Oh, I'm taking this course because I want to be able to learn how to help head and neck cancer patients." And so I decided that's what this is. And I realized quickly, it's best to not put it in a box. I
Mm.
think this modality, and when I stopped putting it in a box, then I was able to, be more relaxed and more comfortable with where it could go and how it could, help the patient as another thing that I can do to help a patient.
I just taught a class in Norfolk, Virginia this past weekend, and since 2020, a lot of the techniques have evolved even more than they had before that. But we've really added a lot of different tongue conversations and tongue techniques, including one where we bring in tongue awareness and tongue exercises. So I'll do air quote for strengthening. But it was really interesting because the SLP who came up as my sample, demo to demonstrate the technique to the class. She didn't say any of this beforehand, but we did some of the work, which involves doing some of the classic manual therapy stretching, but also using our thumb to provide essentially instantaneous and location-based biofeedback to allow the patient the sense of, oh, I'm not doing that, right? I'm feeling a lack of engagement on the tongue, and I just sort of gently press on it to reinforce that. And there's been a lot of like comparisons with the use of the IOP and things like that, but definitely a more individualized basis. And what was interesting is after we were done with that sequence, the SLP who had acted as my patient back for that demonstration said to me, before I came up here, I was really wondering how this really would apply with the head neck cancer population. But she said, as
Mhm.
soon as you did that to me, and I noticed the reach into not only the tongue, but the whole mouth, the pharyngeal wall, she said it was like an instant resonance to say, I get it. I get it how this isn't just for voice or for tongue posturing, right? But how it can be impactful for a lot of different things. And I love what you said about not putting it in a box, because that was a classic example of how she'd even done so before she even kind of felt the technique.
Yes. And I think there have been so many times that I've used manual therapy when I see patients, for a variety of purposes. We're working on a lot of different goals, but it is a great tie-in to how awareness of the muscles and awareness of the placement and what you can control and what you can't control, what is sensation, what is
Yeah.
not.
Yeah.
There's a lot of aha moments that happen with patients when we do, this work, because it is just a totally different kind of approach that yeah, if you put it in a box, then it limits its potential. And so for me, I've used so kind of fast forward, I was still doing home health when I took the second course, the balancing the body course. And then now I've moved into private practice. My private practice began as a telepractice only for 6 months. I did it as a side venture, and then moved into doing it full time. And then we had the physical location come on board. And in this setting, it's very different than when I did it in home health, because I can control the environment a lot more. There's a lot more things I can do in terms of different types of chairs I can use. And you know, different people like different types of mirrors. Like, I mean, it's just different than a home health
Yeah.
setting where I'm,
Yeah.
I'm moving into their space. And I've worked with patients who've had strokes. It's been really um, awesome. It's been really cool to work with that population. I've worked with patients who've just come in for choking and swallowing concerns. And then I've also used some manual therapy for even some younger populations than I thought that I would, and some adolescent populations where we're working on articulation and resonance, and how manual therapy can facilitate the posture and, the focus of the articulation, which has been really kind of interesting.
Yeah. The I have on the I just had to pop up on my Facebook page because there's this quote that I love by a researcher who I quote quite frequently by the last name of Jerry, that so epitomizes kind of what you just said in the way I look at it. Because people put it in that box. It's like, okay, when are the tissues too tight? When should this be appropriate? But Jerry's quote that I love repeating is, clinicians should remember that manual techniques are not tools to fix the person's body. Rather, they provide the opportunity to communicate with the patient's brain, similar to words. And I just think that, you know,
Yeah.
kind of allowing our interventions to be tapestries instead of, okay, I'm going to reach for this bottle now and or this bottle later. It's like blending them all together. And to, unfortunately, manual therapy has always been seen as fixing issues in the tissues. And even though the research is showing that's not accurate at all, that's how the public still views it. And unfortunately, that's how a lot of people are still teaching it. But when we realize that, touch just opens up another means of awareness and communication, it really, I believe it can slip seamlessly into all of our interventions. I use the concepts with my exercise-based patients. Sometimes just touch-based cueing can be so impactful that we don't really have to hold and do that traditional manual therapy stretching. So it's really nice to hear that you've kind of exposed your range of populations from pediatrics to strokes, et cetera. And that's what I find so fascinating. I get to live vicariously through you and other people who take the class, because I'm really forthright in saying, I'm not at SLP. I don't work with the patients that you do, but can we open up this line of touch as a means of communication, and then you share decision making, and then have you go and discover what it's useful for. And I love hearing the stories that we're doing in these videos, but also the feedback that I get from SLPs and other people who are doing this work in different professions.
And you know what I love? Like, if you were to ask me, when do you do the rah rah cheerleader chant in your brain when things happen in visits? When in the interaction of me asking and them sharing, and then them, when they say, would you would you move my tongue, blah, 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 or would you touch this part of my face or this part of my neck? That's when I rah in my brain, because it's like, okay, he or she is understanding. I want to know where you want me to go with this. And then I suggest, she suggests, and that's so exciting. Because not one thing I learned is that not every patient, feels comfortable feeling like it's okay to ask for something.
Yeah.
Uh,
Yeah.
and so the dance of, and the whole, like, we're a team. I really want to know what you think.
Yeah.
It matters and it's valuable. And when patients get that, and there's more of a dance of, can we try this? Can we try that?
Yeah.
And then they say, oh, well, I'm feeling blah, 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 blah. It's so cool when we reach that place, because then we're really doing a dance.
Yeah. In every class I teach, I try to remember to say that even though learners come to the class thinking they're going to learn some nifty hands-on skills and techniques,
Mhm.
which I hope they do, but what I really hope is that they leave with a concept of shared decision making, not just in manual therapy, but in all of our interventions. And have you, along that, have you found that some patients are more hesitant to feel like they have worth in the therapeutic encounter, getting them to actually participate in this way?
Yeah. I think it can be a lot of reasons why some people are hesitant. It may be that it may be they don't feel like they're worth it. It may also be kind of a cultural thing, that they're used to, the model that they have. They go to the specialist says, this is what I say, and they do it. And I don't know if it's about worth, or feelings of worth or not feelings of worth. I think it's also sometimes just, this is a whole different way to do it. And um for me, I have to repeat myself several times for some patients to really understand that I'm asking for their feedback, and I'm
Yeah.
asking for their ideas. And I think you're right that the idea of everything is a negotiation.
Yeah.
And negotiations don't have to be under bright lights and, sweating brows, right? It's like, wow, you told me that, and look what came out of it. And you asked this question, and I have learned something from you. And to let patients get, so I don't know if it's about worth. I think it's about also just a different it's like a different mindset.
Yeah.
Um,
Yeah.
and and some patients will go into it easily, and some patients will not. And there have been some patients that have said, you know what, I don't feel comfortable
Yeah.
saying how I feel. And I
Yeah.
have to respect that too.
I was teaching in Asia, in Taiwan, last month, and it's cultural societal differences can be huge in terms of how, not just how patients react and respond, but clinicians themselves and the roles that they're willing to um, stay in or expose themselves to. And that was a challenge. But I think even in this country, I hear clinicians talk about their unique social, economic, cultures that they work with, that many two people do find it very difficult to elevate their patient who is used to being disenfranchised, et cetera, in the therapeutic process, feel like they have a place and worth. And to me, I love having these conversations, because then it just brings us closer to figuring out ways to foster that, and that's really it's really the foundation of the work that I both teach and use here in my clinic with my patients. So, Wilson,
And
if you, oh,
I
go
would
ahead,
say
sorry.
even just the culture of men versus women.
Oh, yeah.
I
Yeah.
find, I don't know all the patterns yet, but I'm collecting, the trends that I see, that it is sometimes harder for certain people of different ages or different genders or different, socioeconomic statuses. And then, we can talk race, all of that. But I think and every person is an individual, even in their, demographics. So I think it's been kind of interesting to see the evolution of a patient. Okay, you were okay with me asking that. Okay, well, let me ask that. okay, you were okay with that. Well, let
Yeah.
me ask this. And the comfortability. And I think for me, the more times I've done manual therapy, the more times I've felt more comfortable myself. And I think that's kind of important because I had to really practice with family members. And that was really valuable to me. Friends who didn't have a speech and language impairment, but can I practice on you? I just need to get more and more comfortable. I want to feel like when I'm doing this, I'm not feeling any feelings other than ready. And so practicing with different sizes of people and different, and realizing that every person has in the negotiation is that touch, the intensity factor, because people that I thought would be okay with a certain intensity amount in terms of pressure, it was not what I would have predicted. And so I've just really realized having that talk about touch before the touch happens has been really helpful.
And as you stated before, sometimes repeating it over and over, because so many patients are just so fine with you saying, you're saying to you, do what you think is best, Wilson, and it's like, well, what I think is best may not align with your values and expectations and fears and hopes. So let's find out what kind of pressure not only feels safe, but useful. And even since 2020, the questions that I ask have evolved just so much to simple questions like, when we're working, I'll ask him, does it feel like we're doing anything right now? And I just shut up then and let them chew on that one for a while. Because instead of saying, 0 to 10, how much pressure, et cetera, which, they have their place. But I just love to ask that simple question. Does it feel like we're being therapeutic right now? Does it feel like you're getting your money's worth from what we're doing? And I love just breaking it down to that bare bones. Let's just stick to the simple topics. Does this feel like it might be helpful?
Right. And I've started saying, tell me about this. I just say, tell me about this.
Yeah.
And especially with the patients that are not able to tolerate much in terms of pressure, and they're not able to tolerate much in terms of time.
Yeah. Yeah.
Um, I mean, for patients that that have a reaction that they didn't anticipate, I really am. Oh, how about this?
Yeah.
It's like,
Yeah.
tell me, what do you think? And I've also one thing I've noticed that I didn't know in the class is that for some patients there are biological reactions that are not anticipated, like a lot of yawning
Mhm.
is something that I've seen a lot of. And I've just kind of had a curiosity of just what you're having this reaction. Certain populations, just there's a lot of yawning that's happening, and and it's been really a great journey. I'm so thankful I went to the class because it's also opened doors to, that everything is a negotiation. Of course, there are ethical things I can and cannot do in terms of, frequency and other things.
Right.
I have now on my wall, ask me anything, ask
Mhm.
me anything. And people actually do sometimes.
So let me ask you something, Wilson. If you had um, one Wilson's tip to share with new learners in this work to get started, getting over that hurdle of actually beginning it, what would it be?
So if they've taken the class and it's the
Yeah.
day
Yeah.
after,
Yeah.
it's the day after, I would say get your best friend, get your partner, get your neighbor, get your high school son, and just say, could I practice on you because I want to not lose the practicalness of what I learned yesterday, and I promise I won't hurt you. And can I ask you questions that may feel kind of different because I need to get comfortable asking them?
Yeah. And that's
That's
perfect
what I
because
would
it's
say.
almost as getting comfortable with the touch is what seems to be the hard part. But I just watch in classes people just wrestling with these questions, with these concepts of the awkwardness of this communication. So I think both of them merit just practice. And I would add to yours, yeah, do it with friends, do it, with acquaintances, but do it with your patients too. Um, don't wait until you get good,
Right.
allow
Right.
them the benefit of even some of this communication touch right away. So
And
great.
I would say start with one movement, one touch technique that you did in the class that you felt like I could, and even as you're taking the class, what is one technique that I got this. And then I can, move more comfortably into others.
Great, great.
Because that, the tongue techniques, I really felt like were easiest to implement first. And
Great.
that's where I began when I started, you know, I think the tongue techniques, I felt like this is simple enough that I can do this. The challenge then is the talking, right? When you have your tongue, someone is, has their tongue, you know,
Being held.
stabilized by my fingers. And so, and then that's another conversation about, how to, do we want to do a thumbs up, thumbs down, or do we want to pull back, talk about it, and then I go again. But
Yeah,
I felt like the tongue techniques were the easiest for me to just do because it didn't require any kind of special positioning. And it was a good place to start.
great, great. All right. Thanks so much for agreeing to take part in this. The more of these peer-to-peers we have going on, I think it sort of fits the bill for helping people kind of figure out a way through all this. So thanks so much for taking the time.
Oh, I was going to say one more thing. One thing that really helped me was having a script for how to describe what we're going to do and practicing it before the first patient.
Yeah.
And because a lot of patients think it's massage therapy, or they think it's, they don't really know.
Mhm.
And the whole, if at any point you want me to stop, do this signal, and I will completely hands off. I'll step back, and then if and when you're ready to talk about it, we can. That has helped some patients, and it helps me know. And it's just, being so flexible and being willing if I need to take a break and they need a moment, and just being willing to just wait and
Yes.
rest.
Got it.
As they process what they're doing helps, because then we're not speeding up the process, because this is a slower pace, and me and my ADHD brain, I'm jumping around, and I've had to learn I can't jump around on this. I have to really allow myself to take the time. And that's another thing that helped me.
Great. Yeah. Well, in addition to having your practice in rural New Mexico, you also run a great website. Do you want to plug it here?
Sure, sure. And you are one of the supporters of our website. Nice Speech Lady. I have a number of resources on there that are complimentary. It's not anything you have to sign up for to benefit from reading and using. There are a lot of printable PDFs, and I have blog posts and other ready-made home exercise programs and materials. And in the last 2 years, I've had to take a step back in producing the content because of having the clinic here that's had to take things in the forefront. But I have to tell you, I've got about 100 ideas that I have on my stockpile list of things that when I have the time, I'm going to be producing more materials. But it's all the content is still available on the site. So check out Nice Speech Lady.
Great, great. All right. Well, thanks for agreeing to be a part of this. It was nice talking to you.
Thank you. I appreciate it.
Okay.